ultrasound for assessment of female infertility. There are two types of patients who are coming for ultrasound or referred for ultrasound with complaints of infertility. The one is the primary infertility and second is secondary infertility. In cases of primary infertility, the patient will usually have a history of amenorrhea if the uterine size is small. Small uterus means when the size of the uterus from the fundus to the external os is 5.5 centimeters or less. It is usually a thin uterus and a small uterus. We will assess its size longitudinally and transversely on grayscale. This is urinary bladder and cut section of the body of the uterus at the widest part of the uterus. And this is the longitudinal view. You can see it is very small. We will also prefer to have a Doppler assessment of the uterine arteries on right and left side at endocervical junction, assessing its resistive index. Looking for any other abnormality like fibroids or any congenital abnormalities like diadelphys or bicornate uterus. The second cause of female infertility is endometrial hyperplasia, in which the endometrium will be hyperechoic. The size will be 21. The size will be more than 14 millimeters. Like here we have 21 millimeters starting from one side to the other side, including the endometrial canal, measuring from myometrio-endometrial junction to the other myometrio-endometrial junction. And usually it is like a swollen endometrium. We don't usually see the line of the endometrial canal. So this is another cause of female infertility. Here it is. We can see the interface. Here is the other side. No endometrial canal visible. And it's hyperplasia, it is hyperechoic. Sometimes we can get the wall, but as it is swollen, so it will be compressed. The third cause of female infertility is Nabothian cysts, which are small cysts present in the Nabothian glands in the cervix, causing dryness of the cervix. That can be large cysts, multiple cysts. Another cause is endometrial carcinoma. In hyperplasia, it was homogeneously wide area, whereas in carcinoma, it will be asymmetrical depending on the size of the mass inside. We can use color Doppler, we will get flow here. We can have necrotic areas in it. Then is a large polyp in the endometrium. It will have a peduncle. We can differentiate it from the endometrial carcinoma from a mass, endometrial mass, or a pedunculated endometrial fibroid, which is also called intracavitary fibroid, which is pedunculated inside the endometrium. A pedunculated fibroid will not have a thin single vessel stalk or peduncle, will have a thick peduncle which will be attaching the fibroid with the endometrial wall. It will be having a thicker area as compared to the stalk of the polyp.